you all for being once again with us. I would like to welcome to our online audience, both in Singapore and globally, students, friends, and colleagues of SUTD. I'm again Rafael Martinez, Research Fellow at the Lee Kuan Yew Center for Innovative Cities at SUTD. On behalf of my colleagues, Dr. Harvey and Mr. Winston Yap and the Center, I would like to thank you for joining us to the day 2 of the Reimagining the Urban in the Post-Pandemic Era workshop. Our next panel is Justice and Resilience, Vulnerability and Inclusivity. In this second panel of the sessions discussing Imagining the Post-Pandemic City, Shifting Conversations and Calls for Actions and Critical Dialogues in a post-pandemic city, it is my pleasure to introduce our panelists. First, we have Mr. Stephen Ellis. Stephen is National Director for the Indonesia-based research organization, Empatica. And next we have Mr. Khun TOLA. Mr. TOLA is the Community Empowerment Project Manager at STT Cambodia. I'm thankful to our panelists for taking time off their schedule and to accept our invitation. As we have been doing so far, my colleague Winston will explain the modus operandi for this session. Winston?
Yeah, thank you, Rafael. So for this session, we will proceed as per normal. So the first 30 to 35 minutes will be an active dialogue session between the panelists and the moderator. And following that, we will be accepting any questions from the online participants. So one thing to note is that these sessions will be recorded and they will be uploaded onto the Lee Kuan Yew Center for Innovative Cities website, and it will be distributed to both the online participants as well as the research network. So from then on, panelists might receive more queries from potential parties that are interested in the conversations ongoing at the moment. So that's the modus operandi in general. And so without further ado, I shall pass the time on to my colleague, Rafael, to start off with the first question for our panelists. Thank you.
Well, thank you very much, Winston. So as you know, there is like, I will read a background for our panelists to have an idea where are we locating our conversation. So here, the main question we will start asking is justice and resilience. No one is safe till everyone is safe. That's a question, of course. So the background is this. The pandemic has highlighted class inequality and exposed the vulnerabilities and hardships faced by marginalized communities. It has also driven home with the point that no one is safe till everyone is safe. So the first question I would like to ask to our panelists is, how has COVID-19 affected marginalized communities in your city over the past year? And what activities, for example, I don't know, your organizations are doing to help these groups? Maybe Stephen can start?
Sure, yes, I'll try. Thanks, Rafael. And yeah, again, thanks again for the invitation and to all of the other panelists and to everyone attending as well. So I'll try to do my best with this. I'm not, I'm not purely an urban expert, and our Empatica's work does not concentrate mainly on urban stuff necessarily, but maybe more to like the rural and urban divide. But I guess, so I'll start with what I'm most aware and familiar with as far as your question, which is that I would say one of the complicated things about COVID is that in some ways, maybe you could say that the vulnerable groups is a bit different than other crises in some cases, which I think has made support more difficult or maybe less clear. So for example, Jakarta gets a lot of migrants, domestic migrants from other areas of Indonesia, lots. And, many of them are living here, maybe for a long time, but actually they're still registered, in their home villages, or maybe they just come here for a few months at a time. And people like these migrants that typically have informal, that are informal laborers or that have their own very small businesses. These are some of the people that seem to be, the most affected by COVID, as far as incomes are concerned. But at the same time, things like social assistance, sometimes, it depends on the type of migrant, of course, but sometimes migrants and informal laborers, it's easy for them to miss out on things like social assistance. And so Indonesia's had there's been a big COVID-19 emergency social assistance programs, which has been either cash or in-kind assistance. There's also been a little bit other assistance, kind of an unemployment training program assistance, also a little bit of assistance for small and micro businesses, but on smaller scales. And I think that for some of, for instance, getting back to migrants, this accessing that kind of assistance is not always easy for groups like that. First of all, like the typical social assistance tends to be tied to where you're registered, to your documentation. And migrants oftentimes are not yet officially registered in the city where they're living. So that can make it complicated when they're trying to get social assistance. Also, there's people that may stay in like informal settlements, in quote slum type areas, who may not be officially registered under the city government because they're living in an informal settlement area. And so we had a family in one of the studies that we were doing, not in Jakarta, but in Banda Aceh, the city in Aceh province at the tip of Sumatra. We had a family there who lives in a slum area, who's trash collectors, and they had the landfill was closed by the government because of COVID-19, so they couldn't do their main job. And then they also couldn't access social assistance because they're not registered because of where they live. So there's issues with their documentation. And then we've seen other issues. I'm not sure if this is so much of an urban issue as it is for people that may have gone back to their villages, where in some cases migrants who maybe have had, what are perceived as like better jobs in the cities, somewhat salary jobs or more regular jobs. Sometimes they don't get, when they go back, sometimes their families don't get social assistance because they were perceived as a better off family before, because they had this job where, he's in Jakarta or somewhere, for a year or two at a time. He's always sending money back. And the local government in the past has looked at them and said, oh, they're actually one of the better off families. But then when something like COVID hits, they lose, they might probably lost their job. Then they try to go back to the village. In some cases also, maybe they no longer have land in the village because they, are not much, because they've been working as a migrant for a long time. So now they don't have that as a safety net, but they're also maybe not registered in the local social assistance. So that's maybe I'll just start with that. So that's something, for instance, with groups like informal workers and migrants that I think is a little bit complicated and gets into issues of documentation and where people are living and things like that.
Very good. Mr. TOLA? I think we cannot hear Mr. TOLA.
Okay, I think, yep.
Yeah.
Yep, because has a that I told you is I had some problem, a little bit problem with the internet.
Sure,
Okay,
no
so
problem.
the first time I would like to say thank you and Mr. Rafael, Steven, and Winston as well. So and participant for that time, and I would like to say thank you that invite me on behalf of my organization that are working with the urban poor community in the city. So yeah, thank you for Steven that raised many issues that happen in Indonesia and Cambodian as well. I would like to say what the community that are affected with the COVID-19 pandemic for that time. You know, uh, for the last year, I think it's a little bit affected for the Cambodian, especially for the urban poor community that STT, my organization, are working closely with them. But since the February, the second wave of the pandemic is a big issue for urban community. Uh, so that's why come back to the last year, the government never take action about the lockdown in the country. But for but for this year, the government has to, I mean, had the lockdown for the city or some province in Cambodia due to is the second wave is a lot of the pandemic happen every area in the country. So that this time I would like to raise is the main issue that happened for the community, urban community that STT working with. I raised about the big issue that right now the community are yeah, as to affected from that pandemic about, I mean, livelihood. You know, community is in Cambodia. I don't know any country, but about Cambodia that I working with those community, they are poor as we can say like that. The previous time they fighting with the eviction, forced eviction. So right now they fight a two main issue: forced eviction and livelihood. Yep, most of them are uh, I mean to make the street vendor, factory hand, or taxi driver, something like that. So when the government, I mean, to lock down the country, lock down the city, so impacted to them and to their livelihood is the it's very hard for them to, I mean, moving to make, yeah, the career or to make something for support their livelihood in the community. So according to my observation and my organization, they are working with the NGO partner. We collect some information about the family in the community that are affected from that. I mean, we are collected about the decrease of income level around 68%, and jobless around 32%, and compound about increased expenditure 30%. That's why we are that the community are affecting with that issue. And one more thing, they challenges the several challenge with the, I mean, the struggle to access the food. You know, Cambodia is the developing country. So when the government take action to lock down the country, the government did not have any specific measure to support them. For example, about the access to food. When, you know, in Cambodia, when the government take action to lock down, the government divide the three part of the area. One is the red zone. Red zone refer to the high risk of the pandemic COVID-19, and yellow zone. Yellow zone refer to a little bit, and about the orange. Orange refer to I mean it's the media of the COVID-19 pandemic, and most of the community, my community, they are working with in the red zone and the orange. They are facing many issues. For example, like the struggle to access the food. You know, when the government take action rashly like that, so the community face with the struggle access, because you know about the mechanism, or I mean approach that the government to take action rashly like that, because the government, they don't prepare anything, so it's affected to the livelihood of community. They cannot go to outside, they cannot make the career, they cannot earn the money, they lose earn income, because you know about the lockdown restrict the small percentage and saving to them, because you know the urban poor community, they don't have any saving account in the bank as like the rich people or the rich family. Yeah. So when the government take action rashly like that, it means to it's the hard for them. It's hard for to access the food, and I mean to make a livelihood for their community, the family. And one more thing about the lack of the saving component with the low income earning to potential. You know, those of them as the poorest the community. So when the government take rashly like that, so how to be to how to uh, uh, and one more thing, uh, it's just like the joke that the government pay less attention to support them the food, but the government take action. It mean with the Ministry of Commerce to sell the any food to them as well. So where is the money get from to buy the food from that the government? Yep. Yep, I think it's just like if we compare about the mechanism the government try to do like that, I think is a impact to them. And I remember that maybe after 1 week, the government take action to lock down one community to protest against authority. And they try and they say to authority, please help me. I don't have any food to eat. Yeah, it is what this is what the community, this is what the urban poor community protest against the authority, because they say that, I mean, I support the government lock down the country, but the government have to make the clear mechanism to support them, because they don't have any food. And one more thing, you know, for the people who live in the red zone, although they have money, but they cannot go outside. They cannot go to buy the food. So why? How do they live when the government take action, but the government they don't have any specific mechanism to support food for them? Yep, that's why I think. Yep. However, in behalf of STT, we try to work with the NGO partner and try to support the food package to them. Yep. STT right now is still going on to work with the NGO partner, and we found the good way to support them about the food package, because it is the emergency support to the community, because they are fighting with the livelihood. Yep. And one more thing, the government they don't have any specific uh, mechanism. Those the community are loan are make a loan from the bank. So right now the bank is still going on. Yeah. So the community call for to the government, please stop the bank to make. Yeah. That's why they fight with the make a loan from the bank. While they lost all income, they lost the job. Yeah. Yep. So right now, uh, those community they are working with, they face with the two big issue. One is forced eviction. One is the livelihood and lost the job and lost their income. Yep. And however, right now, when our organization and another organization, I mean, call for the government, I mean, to it's like, for example, for my organization, I would like to support the food to community. Sometimes authority restrict my organization to provide those emergency support to the community. Yeah, it is right now we are called for to the authority or the government. Please join together for support them, because livelihood right now is a urgency support for those community. So I think it is what as a part of my organization they are working with. And so right now, you know, all those the number of pandemic is the less. However, it's still impacted to the poor community, because they still live in the yellow zone and in the orange zone, and it's hard to go to working. It's hard for to make income for support their family. And one more thing about the forced eviction is still going on. That's why they're concerned about the issue forced eviction and livelihood for support their community. Yeah, it is my part. Thank you.
Thank you very much, Mr. TOLA. I think, Winston, would you like to ask the next question?
Thank you both for sharing about the wide range of issues. And I think part of the reason for this conversation is to understand the local realities. And I think that in a sense, we can feel the frustration on the ground of what is going on. And I think COVID has highlighted some gaps in society that needs to be bridged. So as urban practitioners, as rural practitioners, and as people working on the front line with marginalized communities, I would like to ask, in your opinion, what must be done to bridge existing social and or digital divides? And also, not just from the point of view from the government, but what should the government do, for example, in collaboration with civil society actors to bring forward change? So maybe we can start with Stephen first. Thank you.
Thank you, Winston.
Thanks, Winston. So to bridge digital divides specifically, or also other divides?
Yeah, divides in general.
Okay. Well, I guess I'll try to start with the digital, some of the digital issues first. I guess obviously infrastructure is an issue, digital infrastructure and that thing, but that's that's kind of obvious. But I guess what I would say is coming back to a point that I tried to make in the last session, and maybe I didn't do it well, but is that the government systems, I think part of it is being more flexible and allowing for some context specific strategies at the local level, and that includes for how the government tries to introduce digital solutions, or for example, for education, how schools try to adopt digital solutions. So I think I think there was a little bit of there was a lot of mention about this yesterday, for example, with from the Philippines with Erwin and Ranjit talking about top-down approaches of the government. And I think we've seen that in Indonesia as well, which and Mr. Tolas, talking about it also about, government makes a decision, but there's nothing ready on the back end or on the bottom side to support that decision. And it's a similar thing where I think you've seen some big decisions made about how, things need to, school needs to go online, or people need to register online for assistance or for other things, but it's not allowing for maybe some easier ways that you could also still do that at the local level. So through local actors that whether they're official or unofficial actors that could support some of these things. So I think that would be one thing that I would say is that government needs to have space to at least have some adjustment for context, not only just for urban and rural, but for poor community, so in an urban area for a richer community versus a poorer community, there needs to be, a little bit of room for flexibility and for slightly different strategies depending on context. I mean, again, I'm probably not answering this question well, but to get a little bit of a specific example too about accessing social assistance again. As I mentioned, there's been a little bit of social assistance for small and micro businesses. And at least I think in Jakarta, people were expected to register online for this. And we found, at least from our experience, that in one community, there was a guy who actually was getting paid by people to register for them, because nobody could figure out, people didn't understand the system. They didn't understand the website, I think, and what it was asking, what it was saying, what it meant. And there was just this younger guy in the community that then started just to register people, and people would pay him a small amount to do that. So maybe that's what I'll start with, and then I can hopefully go from there.
Thank you, Mr. Tola.
Okay, Winston, for your question, and Stephen as well. So I think for Cambodia, when the COVID-19 start Cambodia in last year, so we have any problem with that, digital gap about the, to sharing about the existing social, maybe it started in Cambodia around last year in the April. Yeah, at that time the government more interested into make the law to prohibit about the independent journalists to got information of the COVID-19 and another issue that happened from the community. So in April last year, so the government and the court take action to the independent journalist that he just quote the Prime Minister said and released in the social media to the jail, for last year in April about the it's just like we can say it's a kind of restrict of the freedom of expression as well in the social media. And for that year, since the second wave of the pandemic in Cambodia, the government make a two law for restricted to, we can say it's a kind of restrict the freedom of expression as well, because if someone posts something on the social media about the issue of the COVID-19, they will face with the legal action, something like that. So it's a big issue for Cambodia, and the government also enact the laws of state emergency. That law is the restrict about about the activity of people activity or the society that are working is the sensitive action. If, for example, the government and also to enact a sub decree to prohibit about the independent journalists or the independent social media, to got information from the red zone. When the government divide about the three kinds of zone in the Phnom Penh, red zone and orange and yellow. So for the red zone, for the independent journalists or independent society are working on the social media cannot go to got information from that that zone, red zone. The government prohibit, but the government allow the government media to got information from that zone. Yeah, so it's different. Yeah, we can say it's a kind of discrimination for that. Independent media and the government media, they can got information. About, as I mentioned at the moment, the red zone have many issues. It's like livelihood, it's like low income, and the people always protest against the government to seeking for support them about food support, something like that. But so when the independent media cannot go to got information, what happened for that? While the media of the government only that allow to got information from that zone. Yep, it is the kinds of I think it's a kind of the prohibit about the freedom of expression or freedom of press that to ensure by the constitution of Cambodia or international norm, something like that. And one more thing, many people of Cambodian was a jail when they post something that the government say it's not wrong or it's not right. So authority take action rashly to catch and to arrest them into the jail. Yep. So I observed that from about the social media or digital gap the last year is a little bit, but since the second wave of the COVID-19 pandemic, so I mean the activity of freedom of expression on the social media is more restricted by authority, and the government try to make the sub-decree or law to prohibit, especially for non-government organizations that are working with the independent and to promote about independent media in Cambodia. Yeah, it is what my side. Thank you.
Thank you very much, Mr. TOLA. Let me go to another question. This is, I mean, you have already mentioned both in one way or another, this idea of discrimination, we have been talking about that. But and my question is, have you seen evidence of COVID-19 triggering discrimination against certain groups of classes of people, but within the society, not only like from the point of view like structurally speaking, you know? For example, saying who is in which area, it could be like a yellow or it could be like a red zone, as Mr. TOLA mentions. So from a spatial perspective, you are talking about, but my question is like within society, within the members of society practicing or doing things that are at the end forms of discrimination. So my question is, if yes, how can we create more inclusive societies? And again, I'm not talking about only like the system, I'm talking about within society. Perhaps Stephen would like to make a comment about that?
Yeah, I think, you know, about discrimination, yeah, perhaps some of the other Indonesians that are joining will have some of their own experiences or awareness of this, but I can't think of any real obvious general examples actually that come to mind. But I guess one thing I guess I could mention is this is a little bit back earlier though. Is not discrimination necessarily, but I don't know how much you would relate things like social stigma to this. So, for example, one of the issues I think early on with health workers that we're dealing with COVID cases is, you know, there were situations where you know, people didn't necessarily want them to come back to their you know, to their homes because people were afraid you know, about being infected themselves if this was a health worker that's working directly with COVID patients. There's been, it seems like quite a lot of people, again, this is probably in more suburban or rural areas, but people that have been quite suspicious of visiting bigger health facilities or getting COVID tests or being anywhere near COVID testing because they're afraid, yeah, partly because they don't understand it, partly because they're afraid of being asked to be tested, about being testing positive, and a lot of that is due to you know, lack of understanding or uncertainty, but a lot of it's due to stigma. People are worried about being for instance, ostracized in their communities. I think as people have gotten a little bit more familiar with things, you know, as this has gone on for a while now, like I don't think there's as much of that as that there was you know, maybe 6 months ago or 3 months ago. But you definitely had communities where, especially earlier on, where if someone was positive or if someone was maybe thought, you know, might be a positive or a risky person, where you saw quite a bit of either actual stigma or people just really worried about social stigma. And I think some of that at least is due to also information from the government where there weren't really clear guidelines about, I mean, yeah, there were general guidelines, you need to quarantine if you test positive, and things like that for a certain amount of time. But at the community level, it didn't seem like there was good information being shared about, what quarantining actually meant. What did that mean for your other family members? Would you be a lot of people assumed, oh, if I test positive, they're going to immediately take me away and put me in the COVID hospital. What does that mean? So there was a lot of misunderstanding, and I think a lack of good specific information about procedures for things like that. And I think that contributed to a lot of stigma related to COVID and other health things at the time. So sorry, I know that's pivoting from discrimination, but that's something that comes to mind.
Okay, very good, Stephen. Mr. TOLA?
Okay, thank you, Rafael, for your question. So yeah, in Cambodia is different from the Indonesia. We can see a lot of discrimination. Yeah, right now I would like to raise about the discrimination. Some organizations are working with the urban poor community. So we divide into two parts of the organization in Cambodia. One organization that always have the good relationship with authority or the government, it's easy to working with community for that time. But for the non-government organization, they are working with the sensitive issue like land, like environmental, like promote human rights, something like that. It's hard working with the authority, local authority and the government. So for instance, for my organization, it's the real issue. In 12 May, my organization plan to to divide or to contribute the food package to urban poor community that are fighting with the livelihood. So when we bring all the food to the community, authority not allow us to contribute to the community. Yeah, because my organization, we can say it's a blacklist of authority and the government as well. So we are difficult to work with the community with authority, and we try to convince them that we support them because we know that community is affected with the livelihood. But so the authorities not allow us, although we try to negotiate, we try to communicate with any level of the government, but they still not allow us to contribute the food package to the community. So that it means show that about the discrimination to some activity of the local non-government organization they are working with in Cambodia. Yeah, it's a kind of discrimination as well. And yeah, the government say that they're happy to work with all the non-government organizations in that time to provide the food support to the urban poor community or some people who working in the red zone. But however, the activity of local authority is still going on to discriminate us. Yeah. So they need us to allow the authority first before we contribute to the food package to the community. So how? It means that Cambodia is democracy society. So how we need to allow the authority to contribute the food package to the community? Yeah, it's something like that. Yeah, that's a kind of discriminate to our organization that we are working with the authority. We will try to negotiate with them, but it's a kind of they still not allow us to contribute. One more thing is that some community that before I would like to say some community is under of forced eviction of authority. Yep. So before the COVID-19, they always protest against authority or government to claim the land title and land lightening, something like that, and got compensation from the authority before the forced eviction. So when the COVID-19 is going on, when authority know those community is a community is the strong community that always against the authority. So when they have the food package to support them, but they don't care. Authority don't care with them because they know that those community always protest against authority and the government. Yep, about affirmative action. So the COVID-19 is still going on like that. Authority always discriminate them to support about the food or notification is a priority time. For example, some community in the red zone that as in the government, they order to local authority have to commit and to provide the fund support or food package to them. But local authority still ignore about that because they know those communities are strong and always protest against them when before the COVID-19. Yeah, I can see the two picture of Cambodian or urban community that I'm working with. One is the discrimination to the non-government organization that are working sensitive issue, and one is the discrimination about with the community that are strong. Yeah, they always claim their right before the COVID-19. Yeah, thank you.
Thank you very much.
Mr.
Winston?
TOLA. Yeah, so I think the next question that I have in mind feeds in very naturally from what was mentioned earlier. So like when in the keynote speech, we saw how Marco displayed a slide which showed the geography of vaccine distribution. And I think earlier Mr. TOLA also mentioned about the distribution of COVID packages and welfare packages to communities. So I would like to deep dive into like your sentiments of what is going on in your cities. So do you think who should gain priority for access to essential health resources such as vaccinations and protective equipment? And because like, I mean, a few months ago in the news, there was this saying that we are only as strong as our weakest link. But clearly the approach that we've seen in many cities is that those that are strong get more benefits. So what are your views on this issue, and how do you think we should address this issue moving forward? So maybe you can start with Stephen. Thank you.
Yeah, thanks, Winston. Great question. Yeah, I don't know, the updated sort of vaccine distribution exactly, but just to bring up maybe something related to this, and this is also, I don't really know this, so sorry for potentially sharing a rumor here too. But for instance, I know a little bit that Bali has already done quite a bit of vaccinations for the general population. So whereas most of the country is kind of just starting that, it was mainly focused on the older population, and before that, government workers and health workers. From what I've heard, and again, this could, some of it could be inaccurate, but is that, Bali has already done, I mean, I know from my friends that they've already been vaccinated there. So I know that Bali has already done, I think, quite a bit more vaccination than other areas. And that may, the feeling is that may be because of the tourism industry there, and that they're trying to have Bali as hopefully more accessible as quickly as possible. So there's definitely, I think there's going to be issues like that pop up, and that's an interesting thing. And again, it gets back into, are you prioritizing the economy? Are you prioritizing health or other things? I think I wish I had it in front of me. There was a recent survey on vaccine acceptance, I think, which I think overall for the COVID, it's not so bad as far as acceptance. But one of the things that I'm curious about checking again is the difference for poor families, poor people compared to richer people. And then of course also the urban rural gap. I mean, certainly we've seen so far, it would seem that urban areas have much better access to vaccines. But one thing that I'm this is a bit of an assumption, but it seems that also I think you'd find, and probably you see this in other countries, is that more educated people are more likely to want to get the vaccine and already have more information about it, and of course then probably already also have better access because they're probably in a city and things like that. So you're gonna get this difficult situation potentially where you have people from poorer communities or in more rural areas who may already be less less certain they want to be vaccinated, and they may not have as good of access as well, and so drive these curves or these graphs in different directions where you're going to see the strong, as you kind of said, the strong being the ones who end up benefiting or getting vaccines more than other areas, just because you've got these factors that are kind of working together there. I think you've also potentially got issues of documentation again, because I know the vaccines in communities here, again, I think they're depending a lot on you having an ID card for that neighborhood, for instance, if you're going to go to that public health clinic to get vaccinated. So I think there's also potentially going to be issues related to that. Maybe I'll start there.
Thank you. That was great. Mr. Tola.
Yep. If we talk about the vaccinate in a priority, so I would like to raise about according to my observation, so the previous time, so the vaccinated come to Cambodia around February. So that time the vaccinated is the kind of voluntary. So I mean the government declared it to the old people have to voluntarily provide the vaccinated by the medical or something like that. So then after that, the government declares again vaccinated is obligation. So all the people, all the Cambodian citizens have obligation to got the vaccinated. Yep. So I don't know about the scenario of the government, but I think the first time is a kind of voluntary, and then it's application. I don't know another country contact, but Cambodia, something like that. And right now, about the vaccinated to the citizen for Cambodia is the red zone. People who live in the red zone, so have to got vaccinated from the authority. So right now, unbelievable. Around 10 days, the people who live in the red zone got the vaccinated around 50,000. 50,000. Yes, it's a lot. Yes, it's a lot. If we compare to another country, Cambodia is the top 2 from the Singapore. Because it's a roughly right now, and right now it's around 2 million people to got the vaccinated from the authority. But it's a kind of the vaccinated, most of the vaccine is from the China. And it's a little bit from the AstraZeneca. And I think it's a good view that the government pay attention about to provide the vaccinated to the people. However, I think some people who are prioritized to get the vaccinated, it should be the community, because community family is a group of people who are live together. It's a close together. So many people live in the one area. It's a small area, but a lot of people. So according to my observation and non-government organization, they are out there, we suggested to the government should we provide the priority to the urban poor community, because they work closely with the people. They work closely and they are dangerous. We can say it's a dangerous group that to got the pandemic. So we try to suggest the government and authority should be provide the priority to the urban poor community, because you know about the welfare, about the standard of living is a poor already. So the government should be pay attention to those of them, because the condition of living nowadays is a poor already. If we compare about the people, about the rich people or medium people. And one more thing, we also suggested to the government, I mean, to provide the government worker, because a lot of the people, a lot of the, you know, the red zone I mentioned about. I mean, the red zone is the in that place that a lot of the factory. Yep. So I think, yep. According to my observation, I think it's a good as well when the government, I mean, prioritize, I mean, the zone like Cambodia to be three of zone, but what are concerning the government or local authority should pay attention to the community, poor community that I mentioned at the moment, because they they live in the small place, but a lot of people. Yep, it is dangerous for them. Yep. Okay. From my side, thank you.
Maybe to add something, or do you want to go to another?
No,
question?
please go ahead, Stephen.
Yeah, so Khun raised a few good points. One is about this issue of being forced to potentially forced or have a fine if you don't not willing to get the vaccine. We've heard I'm probably not not totally updated on this, but we've heard that a little bit here. For instance, I think they were telling some people that work in traditional markets in Jakarta that they would have to get vaccinated. I'm not sure about the updates on that, but I think, the issue of whether or not people are going to be forced, is going to be an interesting thing to watch. Also, I think to Khun's point about prioritizing urban poor, I think, again, if you're looking at like informal workers, once again, I think if possible, that's a great group to prioritize, also because they tend to, for their jobs, they tend to also, there's many types of jobs where they need to move around a little bit, at least throughout the city, but potentially also they're traveling periodically back and forth from a village area. And so travel restrictions and things being closed, or them needing to get tests and other things like that, all has a big effect on them as well. I mean, in addition to what Khun's saying about, they're living in small areas and things like that, I think the fact that, they often depend on being able to travel a little bit to do their jobs is also, is an important thing too. And
Okay, thank you very much, Stephen, for those comments. I think, Winston, do we have any question from the audience or not yet, right?
No, we don't have questions yet.
Okay, so I think we can close with one last point that this is more like the idea of this question is to wrap up. So can advocacy groups and NGOs like the ones that you represent act as a counterbalance to top-down emergency measures? I think you have already mentioned a few ideas about that, but imagine from the point of view of the future of if this situation of the pandemic will continue, what will be the role of you, the revised role of you as NGOs? Mr. Khun TOLA probably can start.
Yeah, so thank you for that workshop and to invite me to sharing about some issues that happen in another side of the country of South Asia. And thank you everyone. And Stephen also share about the issue that happened in the Indonesia that we are in the Southeast Asian together, we can know each other about the big issue. And yeah, however, I think yeah, it's still going on of the COVID-19. So for my side about the any activity we are stuck, we cannot do anything. As you know, SDT is working to promote about the land and housing right and human right based. So right now we cannot do anything due to the COVID-19. However, we try, to work closely with those community. Sometimes we are hardworking, difficult to work with the authority or the government, but we try my best to promote them. All those we know about the situation right now is very struggle, but we try our best to provide our service to urban poor community as long as we can do. Yeah, thank you.
Thank you very much, Mr. Tola. Stephen?
Yeah, I'm not sure, and again, I'm less familiar with kind of civil society more generally, since we're mainly doing research. But I think, yeah, as you mentioned, I think as far as top-down approaches, like definitely the government needs to build in more room for flexibility and guidance for contextual strategies at the local level, and maybe civil society. I think there's potentially more room for civil society to contribute to strategizing at the local level, and certainly I think they need to continue to do advocacy, particularly in local areas and things like that. But I think that's something that many already do. But perhaps one area is that maybe there's a little bit more room for interfacing. I mean, one of the issue at local levels, of course, sometimes is they may not really have the capacity to tailor things to their areas, or the guidance from the government again is maybe not very good, but actually maybe there's flexibility built in. They just don't know how to use it, or they're not confident enough to do anything with that. So I think maybe there's room for civil society to be able to actually interface a little bit more closely with local governments, whether it's maybe for building capacity, but not necessarily, but also just helping to advocate to, for instance, to district governments here, about trying to either encourage them to push the central government, or for them to look more closely at the flexibility that they may actually have and try to actually use that. Because I think there probably is, whether it's health or education or social assistance or other things, I think sometimes they're actually, the government has these top-down policies, but with the way that funding is done, there's actually some flexibility at the local level still. But people are not always able or confident, or to actually utilize this, or they don't have strategies or examples to build on. So maybe that's kind of an area where civil society can also look to. So working directly with neighborhoods and people still, but also maybe looking and probably many do this, but looking to that next level up to village governments, to district governments, and trying to maybe work with them and help them more directly, if possible, if there's room for that. I know it's not easy working, sometimes with those groups, but I think it could be quite useful.
Very good. Thank you so much, Stephen. And on this note, I think we will need to close our session today. I would like to thank you all for joining this panel, and a special thanks to Stephen and Mr. Khun TOLA for your comments and ideas. We would like to invite you to the next panel. So the name is Urban Reimagination, Filling the Void. This is the last panel of this workshop, and the panel will be led by Professor Widiawati from Indonesia. and Marco Antonio Sardillo from the Philippines. We look forward to having you there and to participate in this last panel of the workshop. Thank you very much. Thank you again, Stephen and Mr. Khun TOLA.
Thank you.
Thank you. Bye-bye.
you.
Winston,
Bye-bye.
thank you so
Bye.
much.
Take care.
Thanks,
See you
everyone.
next time.
Thank you. Thank you very much. Bye-bye.
Thank you.